Hello, I'm Dr. Gerald Chodak. In an earlier video, I discussed the general aspects of having radical prostatectomy. In this video, I want to talk specifically about the retropubic prostatectomy, in which we make an incision from just below your belly button down to the pubic bone. So that incision is going to measure about 4 to 6 inches, depending on your body size. After the operation is done, we are going to leave a catheter or a rubber tube through the penis into the bladder that will drain urine while things are healing back together. The operation is normally done either under a general anesthetic or a spinal or epidural anesthetic. In my own experience, the epidural anesthetic has a lower incidence of complications, but you need to discuss that with your surgeon to see which technique they're going to use. Most people are in the hospital for an average of 1 to 3 days. Today, people are going home much earlier. And the operation generally takes about 2 hours. Some people go a little faster, some people go a little slower, but that's the general average. Now, your catheter is in place. It stays for an average of 7 to 14 days. And once that catheter is removed, it's going to take some time until you regain your ability to have good urinary control. We tell most patients that they can resume almost all of their activities, such as sports and heavy lifting, by about 4 to 6 weeks after the operation. Some people happen to recover a little faster than that. Some people take a little bit longer, but that's the general average. And once your catheter is removed and you're regaining your urinary control, we're going to continue to monitor you for prostate cancer by checking your PSA about every 3 to 6 months. Because even though your prostate has been removed, it's possible for your PSA to go back up if there are still cancer cells in your body somewhere, anywhere, wherever they are, they can produce PSA. Now, what about the advantages and disadvantages of this technique compared to the other surgical techniques? That's a raging debate amongst surgeons these days. The retropubic operation allows us to examine the lymph nodes, and we can feel whether or not that prostate is extending outside the prostate because our hands are in there. The disadvantage is it probably has, on average, more blood loss than either a perineal or a robotic prostatectomy. But the likelihood of getting a transfusion in good hands is still pretty low. It's generally less than 10% of the patients will end up with a blood transfusion, although it's probably still more than using the other techniques that are available. Now, if you decide that you're going to have surgery, again, it's not the technique that's most important, it's the expertise of the surgeon. So you want someone who is very experienced at the technique that they're going to use. And I've said before, there's no proof that one technique gets better results than another technique. Be sure to ask your surgeon important questions. How many do they do? How often they do them? And what specifically are their complication rates derived from good written questionnaires in which they can give you accurate information about the likelihood that your complications might occur. And they depend in part on your age, in part on your cancer, and in part on the expertise of your surgeon. So, those are the general characteristics of a radical retropubic prostatectomy. There's no evidence it's better or worse than any of the other choices available. And in the end, it's something for you to consider if you have localized disease. Thank you.